If you take this popular vitamin every single day, you may be at risk of serious brain damage, especially if you're over 60. And that is because this vitamin has been shown to have some very dangerous side effects, especially for the brain. Even doctors are still learning about the dangers of this vitamin, which is why it's so important for you to watch this video all the way to the end, because I'll be revealing exactly how much you should be taking to protect your brain. But of course, this all depends on how much you take. So this vitamin plays a crucial role in many different processes, including maintaining healthy bones and teeth, boosting the immune system, and even protecting against certain types of cancer. In psychiatry, researchers found that people with higher levels of vitamin D in their blood were more likely to experience depression. Another study published in the American Journal of Geriatric Psychiatry found that older adults with elevated vitamin D levels were at increased risk of developing dementia. And a third study published in the British Medical Journal found that high doses of vitamin D supplements were associated with an increased risk of falls in older adults. It acts like a messenger between your blood and your bones. It's telling your bones whether they need to release more calcium into your bloodstream or absorb excess calcium from the bloodstream and store it in the bones. Why would a vitamin that's supposed to be good for you, especially as you get older, have these kinds of negative effects on your brain? The answer? It depends on a number of factors, including your age, overall health, and whether or not you have any kidney or liver problems. In general, though, most experts agree that taking more than 4,000 international units of vitamin D per day can be dangerous for adults, especially those over 60 years old. That's because your kidneys play a crucial role in regulating calcium levels in your bloodstream. And almost 2/3 of endocrinologists routinely recommend vitamin D supplements to their patients. But these recommendations are often based on outdated or incomplete evidence. But in general, most doctors, the first thing you should do is talk to your doctor about your current dosage and whether it's really necessary. It's always we can. And if you found it helpful, please like and share it with your friends and family. Hope means that many older it's not yet clear what the optimal dose of vitamin D is for adults, especially as we age. Adults are already getting more than enough vitamin D. From just a few minutes in, you and your doctor can decide whether you need to continue taking vitamin D, and if so, how much you should be taking. A little knowledge can be a dangerous thing. But when you have all the facts, you can make informed decisions about your health and well-being. It's particularly for people with certain health conditions like kidney disease, liver disease, and even depression. You and your doctor can determine the right balance of vitamins and minerals for your body, keeping you healthy and active for years to come, that we stay informed and stay safe. If you want to support our channel and help us continue to grow, you can do so by becoming a member. Still have a lot to learn about this complex vitamin and its effects on our bodies each day. To develop more personalized, click the link in the description below. We'd love to have you on board. Recommendations for vitamin D intake that take into account an individual's unique needs and health status. Important to follow your doctor's recommendations and never take more than the recommended dose of any supplement. Do you want to know about the recent studies linking high doses of vitamin D to negative health outcomes like dementia, depression, and falls? People can get all the vitamin D they need from just a few minutes in the sun each day, plus a healthy diet that includes foods like fatty fish, eggs, and fortified dairy products. Many remember, you should also, if you or someone ULL, get access to exclusive content and be able to give your input on the topics we cover. ULove is over 60 and currently taking high doses of vitamin D supplements. It's time to have a conversation with their doctor. Ask your doctor to check your blood levels of vitamin D and other electrolytes like sodium, potassium, and magnesium. With more research, so thank you for watching today's video. Which even vitamins and minerals that are considered essential for good health can be dangerous in high doses. As a member, that's why it's so important to talk to your doctor before starting any new supplement, especially if you're over 60 years old. So why do so many people over 60 take high doses of vitamin D supplements every single day? While it's clear that vitamin D plays an essential role in maintaining healthy bones and preventing osteoporosis, it turns out that many doctors are still in the dark about the potential dangers of overprescribing vitamin D. And your liver is responsible for producing certain proteins that help transport calcium throughout your body. But by taking vitamin D supplements, we can help our bodies absorb more calcium and maintain strong bones. When the balance of electrolytes is disrupted, it can lead to abnormal brain activity, which can manifest as symptoms like confusion, memory loss, seizures, and even coma. In addition, excess calcium in the bloodstream can also lead to the formation of plaques and tangles in the brain, which are hallmarks of Alzheimer's disease. But when we take too much vitamin D, it can have the opposite effect. What's worse, many of these doctors may be recommending high doses of vitamin D without checking their patients' blood levels of the vitamin first. This is a problem because it's impossible to know how much vitamin D you need if you do unknow what your current levels are. Too much calcium in the bloodstream can interfere with the delicate balance of electrolytes, which are minerals that carry an electric charge, such as sodium, potassium, and magnesium. Well, it turns out that the answer has to do with the very thing that makes vitamin D so beneficial for your bones and teeth. I'm talking about the fact that it helps your body absorb calcium. Taking too much vitamin D can also lead to calcification of the arteries, which means that calcium deposits can build up in the walls of your arteries, making them stiff and rigid. This can increase your risk of heart disease and stroke, which can also indirectly affect your brain health. Over time, this can lead to a condition called hypercalcemia, which means that you have too much calcium in your blood. Now you might be thinking, what's the big deal with having a little extra calcium in my blood? Well, it turns out that even small increases in blood calcium levels can have serious consequences for your brain. Normally, this process works very well, keeping your calcium levels within the normal range. But sometimes there can be a glitch in this system, especially when you take high doses of this vitamin. But did you know that it also helps to regulate the amount of calcium in your blood? Calcium is essential for many functions in the body, including muscle contraction, nerve impulse, transmission, and even blood clotting. However, too much or too little calcium in the bloodstream can lead to serious health problems. Because just like everything else in life, too much of a good thing can actually be a bad thing. And unfortunately, most people have no idea how much they should be taking. To understand the risks associated with this vitamin, it's first important to know how it works in your body. That's where this vitamin comes in. When you take too much vitamin D, it tells your bones to release too much calcium into your bloodstream. For example, in a study published in the Journal of Neurology Neurosurgery. So what's going on here? As we age, our bodies become less efficient at absorbing calcium, which can lead to weaker bones and an increased risk of fractures. These electrolytes play a crucial role in maintaining the electrical activity of your brain, including the transmission of nerve impulses. But that's not all. Now you might be wondering how much vitamin D is too much. If you have any problems with your kidneys or liver, it means that your body can't effectively regulate calcium levels, which can make you more susceptible to the negative effects of high doses of vitamin D. This is because, as we age, our skin becomes less efficient at synthesizing vitamin D from sunlight, in fact. A survey published in the Annals of Internal Medicine found that nearly half of primary care doctors, and even if they do, they may not know how to interpret the results of these studies or how to weigh the risks and benefits of vitamin D supplementation. Some people may need more vitamin D than others, such as those who have darker skin or who live in areas where the sun S-rays are less intense. So what should you do if you're over 60 and currently taking high doses of vitamin D supplements? Based on these results, as for the future of vitamin D research, we also need to learn more about the potential risks of high-dose vitamin D. But in the meantime, it's important to remember that more is not always better when it comes to supplements. By working together, remember, stay healthy to find out more.